Okay. Once the airtight seal gets released, the cup will easily come out in your hand. Then you can empty the contents of the cup in a toilet and rinse the cup in running water before you insert it again. Now, at the end of the period, what you will do is again immerse this in boiling water, just as you had done in the beginning of the period, for 10 minutes to sterilize the cup and air dry it or sun dry it. Okay, once it is dried, you can pack it off in its cloth bag or and keep it till the next month. There are a few doubts that may come in new cup users' minds, like whether it is okay to urinate and defecate with the cup inside, whether it would be difficult, or whether it will be possible. So, as you can see in this picture, the cup sits in the vagina just below the uterus, and the urinary system, that is the bladder and the urethra, are in front of the uterus and the vagina, that is ahead of it, and the excretory system, the rectum and the anus, are just behind the vagina, and they are all different pathways, and so the cup never interferes with urinating or defecating. Similarly, you can even have intercourse with the cup inside the vagina, though for some people it may not be very comfortable and they might prefer removing the cup before having intercourse. Now, of course, even though it can be put in simple steps, and may, some of you may find it okay, this is easy, we can do it. But this cup, using use of this cup involves a learning curve. But once you master it, there is no going back. It is just like riding a bicycle. When you're learning in the beginning, you are definitely going to struggle a lot with balance. But once you get that balance, once you learn how to ride the bicycle, then you're good to go. You will never ever forget how to ride a bicycle. It's the same with the cup. This is all about how to use a cup. But when someone is using the cup for the first time, for the second time, they will definitely have a few problems, and I'll try to address a few of those. You might be unable to find the correct size of the cup, for which you should get a proper measurement done by a gynecologist, or you can self measure the length of your vagina and accordingly decide the cup size. Or another option is you can go the trial and error method. Basically, you can buy maybe the medium sized cup for the first time you're buying a cup, try it on along with a cloth pad for safety. If your vagina is holding it properly, there's no issue. Very well, go ahead. If the vagina is not able to hold it, the cup is smaller than required, then next month you can buy the large cup and you can continue using it. So you can do this trial and error method. Then there could also be discomfort felt while inserting and removing the cup. Hmm. That could be because of three reasons. It could either be because there's a mental block or fear of inserting some foreign body inside your vagina, or there could be you could be using the wrong technique, or the vagina could be dry. So in case of the fear, you can take help of support groups or of women and friends who are already cup users. For the wrong technique, you can take help from your gynecologist to learn the proper technique. And for your dry vagina, you can use a lubricating jelly. Another thing that women dread the most are menstrual blood leaks. And those are mainly because the airtight seal formation is not adequate. And so you need to learn proper fitting for this again. At times, some females uh, have very, very heavy flow. And so there could be blood leaks in these females. So they have the option of using cloth pads or period panties as extra safety on heavy flow days. So that is basically all about the menstrual cups. Now coming to the cloth pads. This is basically, cloth pads are basically a modern twist on what your dadis and nannies have been telling all along, of letting nothing but gentle cotton touch your most sensitive areas. So modern cloth pads are made of cotton. They look beautiful, colorful, they are easily washable and reusable. And yet they have conveniences like wings and leak-proof layers. So it is very apt for modern working women. They are also very great for women with sensitive skin who cannot tolerate anything that is made of plastic against their skin. They are also good for people who have maybe some social taboos regarding virginity, and they do not want to insert anything in their vaginas before they get married or before they are sexually active, or those who are married, sexually active, and yet are not comfortable with inserting something in their some foreign body in their vagina. This is also an ideal substitute for the menstrual cup on your low flow days. So you can decide to use the menstrual cup on the first 3 days of your periods when you have heavy flow, and you can use the cloth pads instead of the menstrual cup on your fourth and fifth days. So that is also an alternative. So as I already said, these may seem to have a high one-time cost. However, in the long run, they are very inexpensive as compared to disposable pads. Now, these are a few examples of cloth pads that are available in India. Next slide. Next slide. Okay. Now coming to period panties. These are basically look like the normal panties or the normal underwears that we use, and they are made of triple layers of fabric. The first layer will absorb any kind of liquid. The second layer is waterproof, so avoids leakages, and the third layer is cotton and hence provides maximum comfort. These panties are made of breathable materials. They can be used along with menstrual cups, like we can use cloth pads along with menstrual cups for safety. Now, a period panty costs you around rupees 200 to 600. Good ones will cost you around 600 to 650. But they are worth it, and they are easily available for purchase as well. Next slide. Next slide. Yeah. So you all might wonder, if these products are so good, then why are they still not in the mainstream? What happens is advertisements have a considerable role to play in increasing the adoption of sustainable menstrual hygiene products, or for that matter, any menstrual hygiene products. Then why haven't we ever seen any radical ads in newspapers and on television about menstrual cups and cloth pads? The reason behind this is all makers, manufacturers, and suppliers of these sustainable products are social entrepreneurs. They work on a non-profit basis, and startups who have no funds for advertising in print and television media. So they promote their products mainly through digital media. Naturally, only urban educated women are their main customers. So it is the responsibility of these educated women of India to switch over from disposable menstrual products, which are harmful to us and the environment, to sustainable products, and also forward this movement by educating and creating awareness amongst the underprivileged and uneducated women of our country. So to conclude, these are menstrual products which are good for your wallet, for the environment, for your health, and they obviously make your periods super comfortable. Also, do not think that one person cannot do anything. Every woman's contribution to this transition will definitely matter. So let us together make the earth a greener, better, and safer place, one red revolution at a time. Uh, I would also like to give some references from where I have taken some material. And I would like to give my best wishes to Project Aarogya Dista, that the Rotact Club has started, because it is a very good initiative, and I hope they continue with this. And we'll like to be a part of it again. Thank you, and please do follow us on Facebook and Instagram. Thank you.
Thank you, ma'am. Thank you, ma'am. The session was very informative. I request the audience, if they have any doubts, to drop a message in the chat box.
Sure. If anyone has any questions, please do ask.
Ma'am, actually, I have a doubt.
Yeah, sure.
Whether the blood collected in the cup, in the menstrual cup, will it flow back to the cervix?
Sorry, I couldn't hear you. Can you repeat the question?
Whether the blood collected in the cup, menstrual cup, will flow back to the cervix, or it remains
No,
in
no,
the
it
cup
will
itself.
never. It will never. The blood will not go in the direction against the gravity, right? It will not
Mhm.
go against the gravity. So the blood collected in the menstrual cup, once the cup is full, it may leak at one time, but it will not never go back into the cervix. So that is not an issue.
Okay, ma'am. What is the minimum time which we can keep the menstrual cup inside? Like
Minimum
how
time,
many hours?
minimum time, minimum time you can remove it whenever you want to. Maximum time is 12 hours. So you should never keep the menstrual cup inside for more than 12 hours. Otherwise, if you're comfortable for only for 4 hours, you can remove it and empty it in 4 hours and again insert it. Someone might be comfortable to keep it inside for 10 hours. So they can keep it inside for 10 hours, remove and empty and reinsert. But maximum is a set limit. It is 12 hours, because after that we don't want any infections happening, right? 12 hours is
Yeah.
the limit, and also the cup will also get full by that time, and so 12 hours is the limit to remove it.
There is a question. What about the bacterial or fungal infections?
No, these bacteria, it happens with tampons because there's some material for these bacteria to sit in and dwell on and to proliferate in. However, this medical grade silicone will never host bacteria. And menstrual blood, as such, will also not host any bacteria or viruses. Otherwise, we would have had infections throughout our life in every menstrual period. Menstrual blood, as such, will not host, and silicone will not host bacteria. However, the material of tampons, the cellulose and cotton, that material might host tampons. So these super absorbent tampons have that risk of infection. However, menstrual cups holding blood will never have that risk.
One more question. Does the menstrual cups cause toxic shock syndrome?
No, no, it doesn't. Again, the answer for this is the same as the previous one. Silicon will not hold bacteria. It will not be host to bacteria. It is not a favorable material for bacteria to grow. And so toxic shock syndrome is not possible with the menstrual cup. So you did never need to worry about that.
Okay. So, ma'am, how to sterilize the menstrual cups?
As I said, you have to just immerse it in boiling water for 10 minutes before and after your period. Otherwise, every day during your period, you can just wash it under running water, and that much will suffice. But immersing it in boiling water for 10 minutes actually sterilizes it. And apart from that, you should not keep the cup moist. You should air dry it and then put it inside its bag. If you keep the cup moist, then again it will not stay sterile.
Okay, ma'am. Thank you. I think there are no more questions in the chat box.
Okay, okay.
Okay,
Another
ma'am.
thing I would like to point out is those females who are not married or who are not sexually active, if they are motivated enough, even they can use menstrual cups. It is not only for the married and sexually active women out there. Those who are not yet sexually active can also use the menstrual cups if they are motivated enough. However, if someone is not motivated enough, it is better to go with the cloth pads as the sustainable option before, because if at all before a woman is sexually active, it could be a little difficult to insert the menstrual cup inside. And if a woman faces that difficulty once, she might never go back to the menstrual cup again. So then in such women, it is better to start off with with cloth pads, and then switch to the menstrual cup later on when they get married or when they become sexually active.
Yes, ma'am. Thank you,
However,
ma'am.
in a motivated girl, even using menstrual cups before sexually becoming sexually active is absolutely fine.
Okay.
Any more questions?
Yes,
No,
ma'am.
ma'am.
There's a question from the participant that what if we don't have clean water sources to wash?
Yes, that is another issue that is stopping rural women, or more than rural women, the slum dwelling women, that would definitely keep using clean water to drink. Using clean water to drink, right? If they are not getting clean water to drink, they will boil the water and keep and then drink it. So that water is definitely going to be clean. They can use some of that water to clean their menstrual cups. So it is not, if someone is motivated, there is always a solution. They will definitely not use unclean water to drink. Even those people will definitely boil water before drinking. So they have a source of clean water indirectly.
Thank you, ma'am.
Yes.
Thank you, ma'am. Now let us move on to the second speaker of the day. I request
Sorry?
protect. Hello.
Yeah.
I request. Now let us move on to the second speaker of the day. I request Protector Anne Maria Matthews to introduce our second speaker of the day, that is Dr. Prajna Girish Moore. Ma'am will be speaking about PCOS, that is polycystic ovarian syndrome.
Good evening, everyone. Am I audible?
Yes, you are.
I'm here to introduce the second guest to this session, that is Dr. Prajna Girish More. Ma'am is currently working as the assistant professor at Kashibai Nawale Medical College in Pune. Ma'am was born in Goa and was brought up at Bombay and got her MBBS professional degree at Bangalore Medical College, that is OVARIAN College in Bangalore, and also obtained MS in obstetrics and gynecology at LTMMC Sion Hospital, Mumbai. Ma'am has also accomplished postgraduate degree diplomate in National Board, that is DNB, by National Board of Examinations under Union Ministry of Health, India. Thank you.
Thank you, Anne Maria. Over to you, ma'am.
Thank you so much. Am I audible?
Yes, ma'am.
Okay, I'll just share my screen. 1 second. Is the PPT visible?
Not yet, ma'am.
I am sharing my screen. Is it now visible?
No, ma'am.
Just to support you, share screen once. Yeah, I guess now we can.
Yes, ma'am. Now it's visible.
Okay. Okay, so first of all, thank you so much, you guys. It is very nice to go back to my undergraduate college and be a part of the Rotary Club. Thank you so much for the opportunity to talk. So I'll just not waste any more time and start with my talk. So I will be talking about definitely the most common hormonal problem that women face these days, but the least understood problem, that is polycystic ovarian syndrome. So why is it really important for us to talk about PCOS? According to National Health Portal, almost 9.3 to 22.5% Indian women suffer from PCOS at any given point of time. It is responsible for 25 to 30% of women suffering from infertility. Even women who might, who do get pregnant have complications during pregnancy like miscarriages. They might have raised sugars during pregnancy, which is known as gestational diabetes mellitus. In the long term, these women who have PCOS, who have uncontrolled PCOS, can have complications like diabetes mellitus later on in their life. They can have uterine cancers. They can have cardiovascular diseases. And the problem is, this incidence is just going on increasing with every single day because of our stressful life and our fast-paced life, and the fact that we do not exercise, or we are so stressed and we do not do anything about it. According to Dr. Chang, who's a consultant in Atlanta, who's actively involved with PCOS awareness, PCOS affects 7 million women. That's more than the women diagnosed with breast cancer, rheumatoid arthritis, multiple sclerosis, lupus, all combined together. So what exactly is PCOS? PCOS, PCOD has been a very confusing thing for a lot of people. So it is the most common hormonal problem, like I already told you, among women of childbearing age group. These women usually have infrequent periods, or they have prolonged menses, or they do not have any menses at all. They might have increased male hormones or androgens, which could lead to symptoms like, excess hair growth and acne, and they could be obese, and they have ovaries which are slightly different than normal. They have their ovaries have multiple small cysts or follicles, and they are incapable of undergoing ovulation. So why is it that some women have this problem, some women do not have it? So basically, it is largely unknown. Apparently, when ovaries were being handed out, some women just got ovaries that were hyperactive and produced a lot of follicles, and some women just got ovaries that were very quiet. So it has a huge genetic basis to it. There are studies that say it is autosomal dominant. It has an autosomal dominant inheritance. That means if a mother has PCOS, there's a 50% chance that the daughter might also have it. The second most important thing which we can control, which is treatable, is the lifestyle factors. So a sedentary lifestyle, eating junk food, and being stressful, not exercising, not meditating, these things contribute to a person having PCOS. Another thing is insulin resistance. So it is very confusing about, insulin is related to sugars, and how does it cause PCOS, which is a problem with the, female reproductive system and the ovaries. What exactly happens is, when you take sugars in your body, it is absorbed in the blood. What insulin does is, it takes up the sugar from the blood and, lets your muscles or other organs utilize it so it can produce energy. What happens in women with PCOS is they have insulin resistance. So they're not able to take up, so the insulin is not able to take up sugar from the blood. As a result, the blood sugar raises, right? Because the blood sugar raises, the body produces more and more insulin. As a result, the insulin levels raise. So the insulin just does not act in certain parts of the body. It acts also on the ovaries. And what it does in the ovaries is, it increases the luteinizing hormone. That is a hormone produced by the ovary. So because the luteinizing hormone increases, the ovary starts producing more and more androgens. And androgens is the male hormones, which is not good for the ovary. So because there is an androgen axis in the ovary is not able to ovulate, or basically it is not able to do the function that it is supposed to do, that is produce an egg. That is why there are tiny multiple follicles which would have otherwise grown and grown to produce a follicle, but it won't because of high androgen levels. I hope I have not confused you with this. So this is how the patients will normally present with. So because of increased male hormones, there will be acne, there will be hirsutism. Hirsutism is again excess hair in areas which women normally don't, like chin, or on their navel area, or on their upper lips, and anywhere. And they can have male pattern hair loss. They can have menstrual irregularities, like less bleeding during menses, or infrequent menses, or completely no menses at all. Some of the other features of PCOS are acanthosis nigricans. That is another thing which happens because of insulin resistance. That is where you see a blackish pigmentation on maybe back of your neck or your axilla. Women can have fertility issues. They might have difficulty getting pregnant. That is because they don't really know when they are ovulating. Their cycles are so infrequent, and so many times there is no ovulation happening. The bleeding is anovulatory. Bleeding happens even without ovulation sometimes. So that is why they have a lot of difficulty getting pregnant. There's a lot of weight gain. They are usually obese, and they have a lot of difficulty losing weight. And then again, baldness. So the thing is, basically there are so many symptoms, and it is very difficult to pinpoint one symptom to PCOS. So in 2003, there was a meeting in Rotterdam, and they formulated a criteria for diagnosis of PCOS, and they said that if a patient comes to you and has any of 2 out of 3 criteria that I will be telling you about now, you can label that patient as a PCOS. So if the person has menstrual abnormalities in the form of oligo or anovulation, that is afrequent menses or no menses at all, or if there is signs of increased male hormones, either with facial features like excess hair or acne, or there is increased male hormone level on a blood test, or on an ultrasonography if you see more than 12 follicles, small follicles of 2 to 9 mm, or if the ovarian volume is more than 10 cc. In 2013, again, this was revised by Eshrey, and there was another meeting, and they decided that the sonography criteria could be changed, and they decided to take 25 follicles and the ovarian volume to 20 cc. So because there is not a lot of awareness about PCOS, there are a lot of myths and a lot of misnomers around it. The whole thing starts with the name of the condition itself. PCOD. Do I have PCOD, or I have PCOS, or I have PCO? Nobody really knows, what to say. So initially in 1935, when Dr. Stein and Leventhal, they were studying about these conditions, they realized, fat women who had excessive facial hair and acne, and they had menstrual problems. What they did is they did wedge dissection of their ovaries.
Ma'am, sorry to interrupt. There is a slight disturbance in your voice, like crackling voice.
Now is it better?
No. There is a disturbance, slight disturbance in your voice.
Now?
Please. There is a cracking voice in your system. Please kindly check that.
What do I do? Is it fine now? No?
No, again, there is a disturbance, ma'am.
It's okay,
Again, there is a
ma'am, but
disturbance.
it's audible.
Are you not able to understand what I'm saying?
No, ma'am. Some bit of disturbance is there, but it's okay.
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 So where was I? So yeah. So the whole name itself is confusing. Is it PCO or is it PCOD or PCOS? So in 1935, they decided that Dr. Stein and Leventhal decided to name it PCOD. So that time it was polycystic ovarian disease. But over the time, we realized that because there are multiple symptoms involved and there is not just one disease, it's a group of symptoms. That is why it is known as syndrome. So now it is popularly known as polycystic ovarian syndrome. And PCO is just polycystic ovaries. As in, polycystic ovaries is a finding which we get on sonography. Doesn't necessarily mean the patient has any symptoms. So if you do an ultrasonography of a 17-year-old girl, you might find that she has multiple follicles. Doesn't necessarily mean you can label them as the PCOS. Okay. Other misnomers around it are patients feel when they're diagnosed with PCOS, they feel that they have large painful cysts in their ovaries, which is not necessarily true. As you can see in the diagram on the top, that shows a large ovarian cyst, right? And the one below shows a polycystic ovary. That polycystic ovary doesn't really have cysts. It is a misnomer. It has small, tiny follicles.
Ma'am, you're not audible.
Myself. Yeah, am I audible now?
Yes, ma'am. Yes, ma'am.
Yeah. So, so these are not basically cysts. They are just small follicles which fail to develop into big follicles which would later ovulate, right? People believe that if they have PCOS, they can never really have kids. That again is a huge myth. Women with PCOS can conceive. If they can't conceive on their own, there are doctors available who can assist them in their conception with or without medications. it is considered that all women have a specific phenotype that is known as PCOS phenotype, as in she's supposed to be fat and she's supposed to have a lot of acne and a lot of facial hair. But that again is not true. There is another variety of PCOS which is known as lean PCOS. So these women are usually quite slim, but they do have insulin resistance and all other features of PCOS except for the fact that they're not fat. So another myth is that all women experience same symptoms. That again is not true. Some women might just have acne and hirsutism. Some women might have just menstrual abnormalities. Some women might have both. So it is not necessary that all women will have similar symptoms. Okay, going on to the next slide. Yeah. So now that we've understood everything about the complications, and the clinical features, let us talk about how we can beat PCOS and how we can do it together. So you might have noticed that when you go to a doctor and you're diagnosed with PCOS, the doctor usually gives you a list of investigations. These investigations are basically just to rule out other conditions that might be similar to PCOS, so as to treat you better. These other conditions are, congenital adrenal hyperplasia or hyperprolactinemia or hyper or hypothyroidism. These conditions present in a similar way, but you need to rule those out. All, the blood tests in a PCOS most normally come out to be normal, and that is reassuring. Max you can get is a raised male testosterone or raised male hormones or raised LH. Other than that, the investigations usually come out pretty normal. Okay, so coming to the treatment part of it, the first and the most important thing is to talk to the patient and understand what is the symptom that is most bothersome to the patient. You could have a 13-14-year-old patient who's just worried about her acne, or you could have like a 22-year-old patient who's getting married and wanting to conceive, or you could have a 25-year-old girl who wants contraception and is really worried about the weight. So the symptoms vary. So you need to target the symptoms, and you need to make a cater to specific symptoms and make a specific treatment plan for each and every patient. So lifestyle modification, you cannot stress the importance of lifestyle modification in treatment of PCOS enough. Let's start with exercise. Aerobic exercise for just around 30 to 35 minutes every day, or 3 to 4 days a week. And even weight training helps in combating insulin resistance. These things go a long way. When it comes to exercise, it is usually better if you do something that makes you happy, so that you can continue it in while you're losing weight. Dietary modification again is very important. You need to make sure you take a low sugar, low carbohydrate, low fat diet, a diet which is rich in fruits and vegetables and has a lot of antioxidants. Junk food is an absolute no-no. The whole thing with low carb diet is because like I told you about how the sugar increases, and how because the sugar increases, insulin increases, and the whole cascade starts. So it's always better to take a low carb diet, and with the help of exercise and diet, the weight, even a 10% reduction in weight can show tremendous effects clinically. The patient, the cycles become very regular. The acne and the facial hair might take some time and may need some other assistance, but it does come back, and lifestyle modification goes a long way. This is just a really sad ovary and uterus which is undergone the 8 steps of lifestyle modification, and then it becomes really happy. So let's just talk about few specific complaints that patients come with, like menstrual irregularity. So again, regular exercise and dietary modification will most commonly reverse it, but in case it does not, patients are usually put on oral contraceptive by the doctors, because these pills will what they will do is they will increase your sex hormone binding globulin. That is a molecule which will take up your extra testosterone which is roaming around in your body. So it will decrease the rest of your features. Women who have PCOS do not really ovulate. So as a result, they do not have progesterone in their body. So adding a progesterone sometimes also helps. And metformin is actually a drug that we use in patients with diabetes. But as diabetes and PCOS have insulin resistance in common, it is seen that a lot of times adding metformin to patients with menstrual irregularities helps. Now coming to acne and hirsutism, lifestyle modification and diet again is the primary treatment goal. Something else that you can try, which is not permanent, but which can help with the symptoms and the stigma and the stress, is you could go for threading or waxing or epilation or laser treatments. But this is not a foolproof treatment. With the reversal of your hormones, it might come back or it might grow back. So if it is not coupled with lifestyle modification, it is just going to come back. Patients with these symptoms are usually also added on oral contraceptives with anti-androgens, along with some or the other form of laser treatment or epilation. Finasteride is another anti-androgen. Basically, these will inhibit all your male hormones in the body. And metformin again helps in the way that I've already told. Acne might sometimes require treatment like antibiotics, local antibiotics like erythromycin or isotretinoin. Infertility again has to start with lifestyle modification, but if a patient is not able to conceive, she can go to a gynecologist, and what the gynecologist does is she does sonographies to see if the ovarian follicles are growing, and if they are normally growing, she can have a planned intercourse around the time when the gynec expects the follicle to rupture. But if this does not occur, the gynec can actually prescribe medications for the follicles to grow. Sometimes what happens is 2-3 extra follicles can also grow because of these medications, and there's a little bit risk of having twins or triplets. If this still does not happen, patients with PCOS have to undergo this treatment known as laparoscopy, in which they burn the follicles so that the symptoms come down, and then they plan to conceive. If none of this works, patients can always go undergo in vitro fertilization. So September is the month of PCOS awareness, and PCOS is an everyday struggle for women. And so let us not give up. Let us keep the awareness going. You don't really know how strong you are until that is the only choice that you have. So I would like to end my talk here, and thank you so much for the opportunity from all of us at Team Gynosaurus. Do follow us on Instagram and Facebook. Thank you so much.
Thank you, ma'am. It was really informative. I just missed one question for Dr. Mohini Padwadhan, ma'am. Shall I read it out? Dr. Mohini, ma'am.
Just a minute. I'm unmuting myself. Can you hear me?
Hi, yeah.
Yeah, sure.
Vaginal yeast infection and proper medicine for that.
Sorry, I could not hear you.
Vaginal yeast infection and proper medication for that.
Vaginal yeast infection.
Yeah.
Okay, vaginal yeast infection is something very commonly occurring in females of reproductive age group, and the main treatment is vaginal pessaries, antifungal vaginal pessaries that your gynecologist will prescribe you, and even oral antifungal drugs. And apart from that, maintaining proper vaginal hygiene is of utmost importance. But basically, this should never be over-the-counter treatment. You should always visit your gynecologist, because the discharge, you might think it is a fungal discharge, it might be some other infection. So it is always better to get it checked from your gynecologist whether it is actually yeast infection or something else, and then you can get medicines prescribed for that. The medicines are basically antifungals, locally inserted in the vagina as well as orally taken as tablets.
Thank you, ma'am. I request the audience, if they have any doubts regarding PCOS, to drop a message in the chat box. Actually, I got few questions. It's for Dr. Pradya Girish, ma'am.
Yeah.
What are the best foods for PCOS?
Best food.
Best food for PCOS.
Like I already told you, green leafy vegetable, lots of salads, lots of high protein diet like fish and chicken and fruits. Anything that is not very high in carbohydrates or sugars. And eating junk food and eating fried food, and that should be totally avoided. You can include nuts and legumes and like almonds and all that.
Okay, ma'am. Does alcohol intake affect the PCOS patients? Alcohol intake.
Alcohol again can increase your calorie intake. So alcohol again should be avoided as much as possible.
Does when we take the treatment for PCOS, are there any chances of reoccurring?
So PCOS, it is not like you get a fever, you take paracetamol and it goes away. It is a lifelong sort of a thing. So you have to continue with the lifestyle modification. You have to continue it. Otherwise, there is a good chance that these symptoms might come back.
Okay, ma'am. Is PCOS treated naturally? By natural remedies?
It can be treated. It can be treated naturally with the help of lifestyle modification, with exercises, with diet, and with meditation and stuff. But if that does not work out, you have to switch to medicines.
Thank you, ma'am. I think there are no more questions. Jyoti, are there any questions there?
Do PCOS associate with mental impairment?
With what?
Mental impairment, ma'am.
Mental impairment.
Yeah.
There is a very strong association actually between PCOS and mental health. So these women have a poor body image because they are having a lot of difficulty losing weight. They have acne, they have excessive facial hair, and it basically affects the mental image, and there is a lot of stress around it. That is also why creating awareness is important, and it is not something that cannot be treated. So counseling along with treatment is very, very important.
Okay, ma'am. Any more questions, Jyoti?
Yeah, I have one more question from the participant. That is, does PCOS associate with skin infections or allergies?
No, not necessarily.
Okay, ma'am. Thank you.
I think there are no more questions, ma'am. Let us move on to the third speaker of the day. I request Dr. Pooja to introduce our third speaker of the day, that is Dr. Rupam Jain, ma'am. Ma'am will be speaking about breast cancer.
Good evening, everyone. Can you hear me?
Yes.
I am here to introduce our third guest, that is Dr. Rupa Jain, ma'am. Ma'am was born and brought up in Surat, Gujarat, where she had completed her MBBS in Government Medical College, Surat, and also MS in Obstetrics and Gynecology at LTMMC Sain Hospital, Mumbai. Ma'am also accomplished postgraduate degree diploma at National Board, that is DNB, by National Board of Examination. Now, ma'am is working as associated gynecologist at Nupur Nursing Home in Surat. Thank you.
Thank you, Pooja. Over to you, ma'am.
Thank you for the kind words of introduction. Am I audible?
Yes, ma'am.
So I'll just share my screen. Is my screen visible?
Yeah, ma'am.
Okay, so on behalf of Team Gynosaurus, today we'll be talking a bit about breast cancer and spreading awareness about it. Now, breast cancer is the most common cancer among females worldwide. 1 in 8 women will be diagnosed with breast cancer in her lifetime. That is, you have a 12% chance of getting breast cancer in your entire lifetime. Women with certain risk factors are obviously more likely than others to develop breast cancer. Now, let us have a look at those risk factors. So, let us have a look at the non-modifiable risk factors first. So, these are the risk factors over which you have absolutely no control. So, let us have a look at them one by one. First comes the age. So the risk of breast cancer increases after 40 years of age, most common in the age group of 40 to 55 years. Next comes the gender. The female gender is 100 times more likely to get breast cancer as compared to the male gender. And yes, males do have a tendency to get breast cancer, although it is very rare as compared to the females. Next comes the race. So breast cancer is more common in the white population as well as in the Jewish people. Next comes a personal health history. If you have had a history of cancer in one breast and have got operated for it, there is a high risk of getting cancer again in the opposite breast. You are more likely to get it as compared to the rest of the population. Then comes the family history. If you have a very strong family history of breast cancer, that is either your mother, sister, or daughter suffering from breast cancer, or more than one family member suffering from breast cancer, or one member in the family suffering from multiple cancers like breast cancer, ovarian cancer, colon cancer, or if a male member in your family is suffering from breast cancer, that makes you a strong contender to get breast cancer later in life. Next comes your menstrual history. Now, the more you are exposed to the female hormones, the higher chances of getting breast cancer. For example, if you have started getting your periods at a very early age, that is less than 12 years of age, or if you get your menopause at a later age, that is more than 55 years of age, then the duration of exposure to the female hormones is more. That means the risk of getting breast cancer is more. Then comes the reproductive history. So now, if you have no children at all, or if your first child is after the age of 30 years, or if a woman has not breastfed her child at all, then that makes her more susceptible to get breast cancer. And finally comes the dense breast tissue. Now, when it comes to the structure of the breast, there are two types of tissue in the breast, in a normal breast, the breast tissue and some amount of fatty tissue. So the more the amount of breast tissue you have, the more likely are your chances of getting breast cancer. Let us have a look at the modifiable risk factors. That these are the risk factors over which you can absolutely control. So first comes the sedentary lifestyle. As we can see today, there's more of a trend towards having junk food, outside food, and a sedentary lifestyle. So lack of physical activity, the poor dietary habits, being overweight or obese, drinking alcohol, all these have a positive influence on breast cancer. Also, if you have had a history of cancer in the past, and for the same, if you have received radiation to the chest, that increases your risk. Also, the hormonal therapy, which is given to the females for post menopause to tackle the symptoms of irritability, mood changes, those tablets also increase the risk by a certain extent. So, not necessary that if you have these risk factors, you will definitely get breast cancer, or if you don't have these risk factors, you're not at all susceptible to get breast cancer. As we can see from this image, if 100 people are suffering, if 100 females are suffering from breast cancer, out of those, only 30 to 40% of these females have had known risk factors. The rest major chunk of 60 to 70% are those patients who are without any risk factors. Now let's come to the genetic factors next. So there's a gene known as the breast cancer gene, which is known as the BRCA gene. There are two such genes, BRCA gene 1 and 2. So if you are positive for these genes, then the risk of getting breast cancer increases. So when should you get tested for it? All of you do not have to get tested for it. You have to get tested for the gene only if you have a strong family history. That is, as we have discussed before, if your mother, sister, or daughter, they have breast cancer, multiple members in your family have breast cancer, one single member in your family suffering from breast cancer, ovarian cancer, colon cancer, everything at once, or if any male member in your family is is tested positive for breast cancer, then you might need to get tested for the BRCA gene. Now, even if you test positive, do not panic. If you test positive for the gene, that does not make you 100% susceptible to breast cancer. It just increases your risk more as compared to rest of the population. That is, you have a 60 to 70% chance that you may be tested positive. So we can begin screening early for such females. When we talk about the screening, we'll discuss it again later. Now, what are the symptoms for breast cancer? You may observe a nipple discharge. It can be either a clear fluidy discharge, a yellowish discharge, or a bloody discharge. You may observe a change in the shape of your nipple. There can be a change in your skin texture, red or flaky skin. You might notice a dimpling or a puckering, or there can be enlargement of pores in the skin of a breast. That is the orange skin appearance, we say so. You may notice a lump in your breast. You may notice any change in the shape or size of the breast, especially if it is more so towards one side. That is, any swelling or enlargement of only one breast, shrinkage or reduction in the size of only one breast, or any asymmetrical breast. It is normal for females to have asymmetrical breasts, one larger than the other or one smaller than the other. But if you have noticed this change recently, then it is of significance. Now, what comes in screening? As you know, early detection of any disease can save a lot of lives. So first we come to the self-examination of the breast. All adult females should perform breast self-examinations at least once a month. If you notice your symptoms, then that may help you to contact a professional at the earliest as possible. So how can you do so? First of all, in the shower. So whenever you examine your breast, that is to be done with the flat of your hands, and you never have to pinch your breast. It is to be done with the flat of your hands. So with the flat of your hands, you may need to examine the breast. You have to press it firmly, lightly over the entire breast as well as the underarms. Check for any change in the texture of the breast. If you notice any lump, if you notice any knot, or any other particular changes in the texture, in the consistency of your breast tissue. Next, you may examine in front of a mirror with your hands by the side, with your hands raised, and also with the hands on your waist. You may look for any change in the shape of the breast, any noticeable swelling, any noticeable dimpling, any noticeable changes in the texture of your skin, any changes in the nipple, and more so be alert if it is particularly only on one side and not symmetrical. You may also check it while lying down. So as shown in the figure, you may lie down and place a pillow under one shoulder with one arm behind your head. And using the opposite hand, you may want to examine the breast again with the flat of your hand. Examine the breast as well as the underarm area and check it with medium as well as firm pressure. You may also squeeze the nipple to check for any discharge. And repeat the same steps for the opposite breast. If you notice any changes in all these positions, that is in the shower, in front of the mirror, or while lying down, you might want to contact a health professional. Then we come to the clinical breast examination. So a clinical breast examination is recommended once every year. This may help the doctor to notice any lumps or any physical changes in the skin, in the nipple, if that has gone unnoticed by your eyes. So that will help in early detection of any cancerous changes. Then we come to the image modalities. Now, normally, females over the age of 40 years are recommended to have annual mammograms. That is screening of your breast tissue with X-rays. That is called a mammogram. So all the females aged 40 years and above should have it annually as a screening for breast cancer. Now, what about those who are younger than 40? They should go for screening only if they have risk factors. Now, the risk factors, again, we go back to if they have a strong family history, if they have tested positive for the gene, then they might want to go for it earlier. Also, if you have any relative who has contracted breast cancer at a very early age, then you might want to start screening 10 years prior to when they were detected. For example, if your mother or sister, they have been detected at a very early age, say 35 years, then you might want to start your screening 10 years prior to that, that is at 25 years of age, so that you can catch it at the earliest. And also for age less than 40 years, an MRI of the breast is recommended, because since the breast tissue is dense, there's more of breast tissue for younger people. A mammogram may not be able to catch any cancerous changes. So we go for MRI of the breast. Now there's certain myths related to breast cancer. Let's break them one by one. So first of all, finding a lump in your breast means you have breast cancer. No, that is absolutely not true. Out of 10 lumps, 8 will turn out to be absolutely non-cancerous if you get it checked. So do not panic. If you notice a lump, you contact your gynecologist immediately, but high chances that it may turn out to be non-cancerous, so do not panic. Now, next myth is men do not get breast cancer. It affects women only. Again, as discussed earlier, the chances are very less as compared to females, but 1 in 1,000 males do get breast cancer. And the death rate among the males is also very high, mainly because they tend to be ignorant about this fact. And so there may be a delay in diagnosis. Next myth is a mammogram can cause breast cancer to spread. No, mammogram does expose the breast to radiation, but the amount of radiation exposure is very less, and that low amount of radiation is not enough to cause breast cancer. Then comes, if you have a family history of breast cancer, you are likely to develop breast cancer too. Yes, that is true that the risk increases, but it is not set in stone that if your family member has breast cancer, then you will also have it. Next comes, breast cancer is contagious. No, it does not spread by contact. Next comes, if the gene mutation BRCA1 or BRCA2 is detected in your DNA, you will definitely develop breast cancer. No, that is again not true. As said earlier, the risk definitely increases as compared to the rest of the population. But if you go for regular screenings, it may help in detecting early detection. And also, if you are quite anxious, then there's one treatment modality that you can go for prophylactic mastectomy once you complete your family, and also prophylactic removal of both the tubes and the ovaries. But again, it is not set in stone that if you test positive for the gene, you will definitely get breast cancer. The risk definitely increases, but it is not 100%. Next is the myth, the last myth, that antiperspirants, deodorants, underwire bras, caffeine, microwaves, use of cell phones causes breast cancer. So no, there are no such studies till now to prove that these things actually cause breast cancer. So that's it. Now that we know all the symptoms, we know how to screen for it, do regular cell breast examinations, have a clinical examination annually, get mammograms done, I think we should all be better equipped now to fight it together. So thank you, everyone. This was the end of my presentation. And I would like to thank Team Rotaract for giving Team Gynosaurus this opportunity. We hope to connect with you again in the future. Thank you.
Thank you, ma'am. I request the audience to, if they have any questions, to drop the message in the chat box. I have got few questions. Is fluconazole tablet better for vaginal infection or not?
Fluconazole tablet is given for vaginal infection, but that is specifically an antifungal tablet. So as Dr. Mohini has earlier said, you might want to get checked by a gynecologist what type of infection it exactly is before self-medicating yourself.
Okay, ma'am. What is the cause of underdeveloped breast?
It is normal to have, if all other features are fine, then even if you have underdeveloped breast, then it's fine. If along with underdeveloped breast, your height is small and all other features are not well developed, then you might need to go for certain tests and consult your endocrinologist.
Okay, ma'am. Do men also need the breast self-examination?
Men may not need it as often since it is rare, but if they notice any change, they should not ignore it. They should contact the doctor immediately if they notice any change.
Okay, ma'am. Any more questions, Jyoti?
Yeah, I have one question from the participant that can a mother with breast cancer feed her baby?
Yes, she absolutely can.
Okay, ma'am. Thank you.
I think there are no more questions here, ma'am.
Thank you.
Thank you, ma'am. Now I request Protractor Srinidhi S.U. sir, the Donor Protract representative of Zone Chalukya, to speak few words on the today's session.
Thank you, Retractor Mary Sonia. And what can I say? That I'm just impressed by the way the team has conducted this particular event. When you spoke about it, I told you it is very important to give it a brand name. And I guess you have created this particular brand, and Aarogya Dista is going to go for greater heights. I'm pretty sure of that in the coming days that you will be reaching wonderful heights and wonderful way of taking forward the entire event. I can say that you have made probably as a mentor to you all. I am proud that whatever so many months of mentorship you have got through this journey of road track has worked well, and almost everyone has been really impressive. The name gynecologist itself has a great power in it. When I saw it for the first time, and it was not failed. Uh, all the three doctors have given us wonderful informations, even from the district side. I'm pretty sure we have the MHM co-chairperson, Protractor Apurva, with us. I'm pretty sure that the report which your club will give will find its best place in the district of Road Track. And once again, congratulations to your club. Keep growing like this. Keep conducting many more events. And I place this on record on behalf of your parent club also. So wish you the best. And thank you once again for organizing such a wonderful event. Thank you.
Thank you, sir. SBI,
Thank you, sir. Thank you. Mary,
yeah.
Our professor Nursing Rao sir has joined with us. Ask him to speak few words.
I request Nursing Rao sir to speak few words on today's webinar.
Is he there in the session?
I think Apurva ma'am is present. Protector Apurva ma'am.
Hello? I'm
Yeah,
able.
ma'am.
Am I audible?
Yes, ma'am.
Okay, sorry, I was not able to hear. That's why. Yeah, it was really very informative session. To see the growth of your club and the club members' commitment is really wonderful. Keep growing like this only. From the MHM committee, whatever help you guys require, I'll always be there.
Thank you so much, ma'am.
Any guidance required will be there, and the session was really nice. All the speakers and the doctors had all the doctors went in depth, and they were still crisp on the topic. It was really nice.
Yeah.
Thank you, ma'am.
So one thing I would like to ask Dr. Rupam Jain, ma'am. When I approached to you through mail, how you felt, ma'am?
It was a good feeling. It was a nice feeling. To see
Thank you, ma'am.
we had started this page with the main aim to reach people, and with your mail I saw that purpose being served in one way.
Yeah, thank you, ma'am. Thank you so much for accepting our request and being here. Thank you, ma'am.
And here is one more question for Pradnya, ma'am. That is like, do medicines have any side effects? That is, PCOS medicines have any side effects on person?
PCOS, usually the medicine that is given is these are oral contraceptive pills. So unless it is taken for a very long period of time, say 5 years, 10 years, something, it doesn't really have much of a side effect. But on a very long-term use, it can have side effects which The doctor who's prescribing you the medicine will tell you about those side effects and see if you're an ideal candidate for it, and only then prescribe.
Okay, ma'am. Thank you.
Thank you, ma'am.
Now I request Dr. Saraswati ma'am to speak few words.
Has ma'am come? In her own name has she entered?
No, no, no.
Okay, I guess it is. I'll give you the co-host access, ma'am. I was searching for you till now.
Welcome, ma'am.
Am I audible?
Yes, ma'am.
Yes, ma'am.
Good evening to all of you all.
Good evening, ma'am.
Yeah, I'm very, very happy and I'm very proud of all my dear students for organizing such a good event. Very knowledgeable and very interactive sessions we've had today. And I hope you keep continuing this good job in other areas of interest also. And I would like to thank all the speakers, knowledgeable speakers, Pradya, Dr. Rupam, all of you. I think you have really given us a detailed version of the PCOs and other side effects, and you've answered all the questions, also queries given out by our students. Keep going. All the best. Thank you very much.
Thank you, ma'am.
Thank you, ma'am. Now I request Narsinga Rao sir to speak few words.
I think it's not online.
Okay, okay.
There might be some technical issues. You can proceed with the agenda.
Yeah. Now, as we are at the end of the session, I request Protractor Nisha to deliver the vote of thanks.
Thank you, Mary. Am I audible?
Yeah.
A very good evening to one and all. It's my privilege to deliver the vote of thanks on behalf of Rotary Club of Government College of Nursing. I extend our sincere thanks to speakers Dr. Mohini Patwardhan Deshpande ma'am, Dr. Pradya ma'am, and Dr. Rupam Jain ma'am for insightful words they have spoke and given us information and awareness about sustainable menstrual health, breast cancer awareness, and PCOS, polycystic ovarian syndrome. I thank our principal, Dr. Sukanya ma'am from Government College of Nursing in her absence. A special thanks goes to faculty advisor, Dr. Saraswati ma'am for motivating and guiding us. I would like to thank Rotary President Ranjini ma'am in her absence. I thank our beloved professor, Dr. Mohini H ma'am and lecturer Narsimrang sir from Government College of Nursing for joining the session. A special thanks to Zonal Rotract representative Srinidhi sir, who always support us in all the events, and thank you for your kind words, sir. I thank Rotractor Apurva ma'am for their thoughtful words. Success of any great event is not possible without the dedication and hard work of club members. So I thank active president of our club, Rotractor Uday, a very supportive secretary, Rotractor Jyoti, for giving welcome address. And I thank all our club members who are helpful for making this session happen. Finally, in the end, I would extend my wholehearted gratitude to all the Rotract members from various club and non-Rotract members for joining the session. Once again, I thank all the speakers and thank you all for making this session a huge success. Thank you. Over to you, Mary.
Thank you, Nisha. Thank you all for joining the webinar. Special
Okay,
thanks to all.
one thing I have to mention, we have shared a
Yeah.
feedback form. Kindly fill that form, then you will get access to view the content, what speakers had shared on the presentation.
Yeah. Thank you all for joining the webinar. Special thanks to all the three speakers of the day. Thank you once again.
Thank you so much from Team Gynosaurus.
I think we
We
can leave
must
now.
also congratulate Mary for a wonderful MC, though you had been quite afraid in the beginning. Wonderful work. With the permission of President, can I end the event?
Sure, sir. Sure.
Thank you. Thank you all so much.
Thank you all for joining. Thank you, everyone.
Thank you, everyone.